Welcome to lesson 2 of Communicate module, where we are going to talk all things expressive language. So this is how your child uses language to communicate with people around them in all different environments. So quick example is if this were a live presentation and I had a candy bar, a wad of $100 bills, and a brand new cell phone on the table, and I asked for a volunteer. Someone raises their hand and I said, "Tell me what you want," without using words. That person would probably point or grab the item that they wanted. I would say, "Congratulations, it's yours. You got it." They would be pretty excited because they probably just walked away with a new iPhone or a bunch of money. Then I asked for another volunteer, and now all the hands go up because everybody else wants that second best item. Maybe somebody wants the candy bar, but the second volunteer, I said, "Okay, now tell me what you want. You can't use words. You can't use any gestures or your hands in any way. So you can't go like this for money or like this. We've already cut out the gestures with the pointing. So how are you going to tell me what you want?" This one's a little trickier, right? So what could you do? Maybe you'd pull out your phone and pull up a picture of it to show me. Great. Nice job. Or you'd pull out your phone. If you had your phone, you could point to it. I would say absolutely take what you want. You walked away with some money or the phone, and now all that's left is the candy bar. But somebody in that audience wants it. So I asked for a third volunteer, and they come up and I say, no gestures, no words, no pointing, no pictures. How are you going to tell me what you want? That one's really hard. So imagine that you really want something. You see it, you know it, and you can't tell and communicate with someone that you want something. That might be what's happening to your child in various environments. They know what they want. Sometimes they don't always know what they want. But when they do know what they want and they can't have it because they don't have the words, the gestures, the communication techniques yet to get it, that's when we see behaviors or crying or frustration, more withdrawal. Because let's face it, if you can't communicate with anybody and no one's willing to try, you're going to kind of just withdraw and do your own thing because you know you're never going to get the candy bar, which is really frustrating. And we don't want that for your child or any of the children. So let's figure out how to help them express themselves. Before we go into all the different types, there is something we got to talk about with the brain. So I'm not going to go too neuroscience-y on you because I am not a neuroscientist, but basically there are two areas of the brain responsible for language. Wernicke's area is more responsible for understanding language. So if a person has an impairment in this area, usually it's called Wernicke's aphasia, and this might be someone who just speaks complete nonsense, but speaks normally like you or I can, but it might not make sense. So it's more responsible for the understanding of language. Broca's area is more responsible for the motor speech aspect of language. So if you have an impairment in this area, this is where we see more of the apraxia diagnoses, and it's the motor speech. The muscles are not coordinating with the mouth and the brain to speak in a coherent manner. So if we have an impairment here, the person may understand language and act like they're saying something, but it comes out all wrong. And then therefore the listener can't understand it. So two main areas. But then you also have to think, we use the visual cortex, which is in the back of the brain, to see things, to talk about. We have in the frontal lobe your executive functioning, your higher level language skills. Then we also have auditory centers in the brain that we need to hear to get to Wernicke's, to get to Broca's, to get the message out. Why I talk about this is because it's such a complicated process. I have many children who are nonverbal or non-speaking, if you prefer that term, and parents always say, "Why aren't they talking, Maggie? What is wrong?" I don't always know. So without having an MRI or having a doctor that is way smarter than me, image the brain and we can see the exact differences? I can't answer that question. I can tell you it's extremely complicated. So if there's a breakdown in an area of the system that's going on in your brain, we're going to have some more difficulties. So we want to be able to support and develop. We know the brain is extremely able to make new synapses, and especially in the early years, it's constantly learning and constantly adapting. If all of a sudden today I decided I wanted to learn Spanish again, I have a little bit of Spanish knowledge from high school and college, but I haven't used it. So I would have to start speaking it, learning it, understanding it, and I would eventually be able to be a fluent Spanish speaker, but it would take time. So your child, if they are not speaking yet or are nonverbal and you really want that, it is possible. However, there are coexisting conditions that may make it not possible. So even more reason to support your child's learning with the visuals and everything I'm going to talk about next. Coexisting conditions, a lot of my students have seizures, which we know send rapid impulses to the brain and may really be impacting that system. That is not something I can stop, you can stop. Seizure disorders are extremely complicated and extremely hard. I would recommend, if your child is exhibiting symptoms, that you talk with a doctor and get more information about how to help your child with those coexisting conditions. A lot of kids, it's not cut and dry. Oh, your child has autism. That's it. There's other stuff going on. So we really need to treat the whole child and the whole, get a whole community involved in that process. If your child strictly has been diagnosed with autism and it is a brain difference, then we can work with that. We can figure out how to help and support them to have more effective expressive communication. The goal for most people is always speaking. But if that isn't possible, there are workarounds that we can still make that child very successful, able to communicate, get wants and needs met, and be successful in a school environment, have a job, have a family, all the things everybody wants for their child. But we have to understand that it's going to take a time. So what do we start with? I want you to think of a baby, and how does a baby communicate their needs? They cry. They giggle when they're happy. They smile at you. They do all these first kind of expressions is how they communicate. They know if I cry long enough, someone will come and help me. They'll change my diaper. They'll realize I'm hungry, I'm too hot, I'm too cold. We figure it out based on their crying. And there is some science that different cries mean different things. I have no proof to back that up. So you can Google that on your own time if you're interested in learning more about that. But first, vocalizations. Now, in this timeline of going through different levels of expressive communication, I'm not going to put ages on it because everybody is developing in their own way. So I'm not going to say vocalizations is only for babies, because I have some kids who still have a lot of motor speech things going on. So an is their way to get my attention. And then we need to support them and move up by maybe using gestures. So this is pointing. This is, if you want to eat, this might be some sign language, a little more complicated with pure ASL, American Sign Language. But if you're watching this in America, if you're not, sorry. But gestures are a great way to start. So if that student gets my attention, they say, and I'm like, and I'm looking for their next reaction because I've made that connection with them, that I'm listening to them. I'm trying to communicate. I might say, and point, you want this? You're hungry? You want to eat? Okay, let's get this. And the child may point towards the refrigerator or their lunchbox, whatever it might be. Gestures are very, very effective in getting their needs met. You might have your child who takes your hand, walks you to the other room, and puts you in front of the fridge to tell you. That is a great time then for you to point to the fridge and maybe say, open, you can sign it. And move up the ladder. So instead of just saying, now they're able to point to what they want. We're getting closer to being a more effective communicator. If they don't have words yet, this is where visuals are really helpful. There is a system, picture exchange communication system, you might have heard of, PACS for short, which is a very strict method of teaching how to use pictures and get what you want. Now, I don't believe PACS can always work at home. In the school setting, I might have a TA that can help me model it and do it all the standardized procedures that come with official PACS. I think very effective. But in the home setting, it might be just using visuals. So you're going to start by modeling it. So now your kid started with the walked you to the fridge. You might show them a picture of drink. So the picture of the boy drinking. Oh, you want me to get you a drink? Pull it off and then show them that if you hand it to me, I can get it for you. So PACS is really taking a picture. Your child would have to hand it to you, and then you give them the item. Like I said, it's a lot of steps. It's a lot of back and forth, and it can be very effective. But I would recommend at home, unless you have a bunch of people surrounding you to kind of help the child get behind the child, handing it to you, and then you giving them the drink. It's kind of complicated for at home. So I would just pull off the PACS picture or the picture and show them drink, and then hand them the drink. So hopefully then next time they might be able to go to their book, or if you don't have a communication book like shown here, you can print out just a picture copy. You can laminate it, put it in a file folder sleeve, so you can switch them out easily and point to it. This is something you could literally put right on a magnet on your fridge. So when the child wants something, they can get your attention by vocalizing and then go run and point to it. This is a more effective way of you having, instead of having to guess what they want, being able to figure out what they want. So this also can be sign language. This can be visual. If you say more drink, I know exactly what you want. Okay. If you say water, I think that's water. I forget right now. If you say water, then I know exactly what you want. So it's definitely, if I say eat, that tells me you're hungry, but what do you want? Because I know with my own children, if I bring them in an apple, they're like, ew, I don't want an apple. I might want them to eat the apple, but they don't want that. They were hoping for the Doritos. So really trying to break it down to be more specific each step of the way. So now your child is using these visuals. You always want to be modeling the words still. You want to just say, you're not going to say, oh, let's pour the milk into the cup and drink the milk from the cup. Too many words. You're just going to say milk or cup, drink, use one word, start small, and then we build on from there into the words. So now if you've modeled it long enough and your kid is able to produce speech, one day they're going to say drink or cup or milk, and you're going to be like, oh yeah. But anyway, they start with single words. So now once they're at single words, you can start modeling 1 to 2 word utterance, more milk or drink cup or drink milk. We want to be working up in a systemic way to then build to sentences. Also, spelling. If your child is unable to communicate because of a motor speech impairment or something else going on in the brain, a lot of adults have found spelling as a way. I had a student on my caseload once who could spell. He was 10 years old. He had a kind of savant, which means a really high intellectual ability, a high ability in spelling and writing. So he would just type. He had a computer and he would just type, or if he didn't have it, he would write out what he wanted. And that was an effective way of using language. It was a little cumbersome at first, but eventually he was able to get something that was more high tech for him, and it really works. Spelling is a good way. Don't underestimate your kids. Try everything. Then there is a whole new process called, not new, shouldn't go back. It's been around for a while, but it's really a known theory now, thanks to Alexandria Zakos. I didn't want to butcher her name, so I did write it down. She's a genius. She took Marge Blanc's work and has really made it a forefront in people's minds of the scripting. We heard you might have a child who can remember strings of language but can't say one word. So now we know that your child would be called a Gestalt language processor. They are not learning analytic language, how you and I might have learned language, or how I just described to you, the kind of moving up process. They learn whole scripts. They learn whole words. So to infinity and beyond, that to them means they're excited because they remember it from Toy Story. It has meaning to them. And then they might be in Target and randomly say to infinity and beyond. And you're like, what? Are they playing Toy Story in the head? What's going on? When they might be trying to tell you they're excited because that to them means something. So these are strings of language. They are rich in intonation. They are rich in meaning, but you really need to be a detective to figure out what it is they mean and then break down language from them. Alex has an amazing site, which you'll get all the sites and the references, called Meaningful Speech. And she is a guru. She knows everything about this. So if you think your child is talking in gestalts or is showing the scripting signs, I would highly recommend looking up, Google Alexandria Zakos, Meaningful Speech. She has so much information out there that can really support you in a more individualized way. So that's my plug for that. I have no relation to her, so I'm not getting money or anything for saying she's great. I just really think she is. All right, so then we move on to AAC, or augmentative and alternative communication. So these are the devices. They start from low tech, which can be that red switch, which might just have a picture on it. And when the kid hits it, it says drink. And that's how he communicates. That starts, and then we build up to a more high-tech system. There are so many apps out there. There are so many different devices now. It's really nice. The picture of the little girl talking with her dad or a teacher, that is a communication device where you can manually touch it. Then there are also scanning systems. So in the other picture, it looks like that child might be using either an eye gaze scan or some sort of scanning system where they can press. Maybe they have a comorbid condition where they can't move their whole body, but they can move their finger. So they can move their finger to move around the screen that's in front of them. So there are so many options out there. We can get, I believe, all children communicating if we just try enough and we keep our patience up, because there's a lot of different techniques. There's a lot of different processes that you have to go through. The old way of thinking, and I say old, when I was in grad school, it was you started with PECs and you had to be proficient with PECs, and then you could move up to a more high-tech device, a communication device. However, there's new research that shows that young children really can benefit from having access to a high-tech device and more language earlier in their development. So I highly suggest you talk with your SLP. If you're on a wait list, I'm so sorry, because they might be able to write a report to insurance, and it's called a justification, which would be able for your child to get a device earlier if it would be a medical necessity. And obviously communication is a medical necessity. If your child gets hurt and can't tell anybody, that's a problem. And even the insurance world knows that, hey, we need to be able to support this. So it's very individualized. It depends on your insurance, what state you live in, but it is definitely something that a speech language pathologist, even if you have an OT, they might be able to help you with. You also need your doctor to sign off on it. So you'll need to involve them from the beginning. So if you have a child who you really think cognitively is able to understand, so in our last lesson, we talked all about understanding. If they understand a lot, and you can use that example of go get your shoes and get in the car, they can follow that really multi-step direction and they can follow language they just can't express. This might really be an avenue for you to start immediately, because they are capable just something in that other process of getting the language from the Wernicke's area to the Broca's is impaired, or a difference might be a little slower, might be need a couple new synapses to develop there. With all of this, I will say this is so important to model. So many times parents and teachers, even speech pathologists, I miss this stuff. Absolutely, I'm guilty of it. Modeling more. So if I want my student to be speaking with an AAC device, I need to be modeling that, because they might understand that I'm saying, go to the car and get your shoes. They might understand that. But if I say it on their device and show them, go to where these words are, car might be embedded in vehicles. And then you might have even broke it down into land, water, and air vehicles. So they might have to navigate a few pages before they could respond or also be able to express that direction. I'm going to say, go get in the car, but then I can also model it to show them where the words are. Do they need to say it back to me? No, they're not going to tell me to go get in the car right now. But if by chance my child leaves his shoes in the car, because my kids seem to lose their shoes sometimes, now they've lost their shoes, but they don't know how to tell me. They could tell me, go get in the car, and that might remind me, oh, yeah, we did go in the car earlier. They probably left their shoes in the car. So you want to think, even if you can express everything vocally, your child understands what you're saying, you're still going to want to model it. So even if you don't want to model, go get in the car, but you can say, go get in the car, and remind them that they have access to these words as well, because at some point they are going to want to be using them. This is huge, because a lot of times devices aren't always with the kid, or I have parents tell me, well, they don't really want to use their device at home. I already know what they want. Of course you do. You're their parent. So instead of making them do it, you could say, oh, you want Doritos? Okay, I'll go get you some Doritos, and touch Doritos on their device, or show them the Dorito picture. Because the more you model it, the more they can see that, hey, this is a little more effective than me just, because we all can be lazy at times. Not saying your child is lazy, but they sometimes will revert back to old ways if it's effective. But it can't be effective in all environments, because now if they go to school and they want to ask me for those Doritos, and I don't know they're in their book bag, and they don't know where the book bag went, they walked into school, flopped it off, and now it's 2 hours later and they're like, oh crap, where are those things? If you had been modeling where Doritos was at home, they would be able, or more likely, not necessarily able, because they probably I can't talk about their ability, but they would be more likely to realize, oh, let me go get my device, and then I'll say Doritos. It might seem cumbersome. I'm not saying you have to do everything all the time. I get that. They're in the bath. It's wet. You don't want to ruin it. The pictures get wet and soggy. You don't want to use all that stuff. I get that. So try to start small. Think of a time when you know you can focus on using this device or the pictures or moving the sign language even. Sign language is great if people understand it. So I have some kids who the mom will tell me, oh, he's great at sign language, but he comes to school and he goes like this. To me, more is this. Are we happy? Are we clapping? So if people don't know, if the listener doesn't know the communication type, that's where we have the communication breakdown. So it's really important, if something works for you and your family, you communicate, hey, he's going to do this for more. Great. I'm on board with that. I can get behind that. We might be able to work with the OT to get that a little more fine motor, so more people might be able to understand it. But for now, I'm on it. I'm going to honor all forms of communication, because it's important that the child understands that I am a trustworthy adult, and that if they try to communicate with me, I'm going to honor it. Now, if they're saying, and pointing, and I'm using, I know what they want, I might say, oh, okay, you want the Doritos, get the Dorito picture, use Dorito on your device, give them the Doritos. If they have behaviors or a little more impulsive, I might give them the Doritos, but still model. Oh, here you go, buddy. Here were your Doritos. Here are your Doritos. I might have to do that 100 times. And I know it's exhausting. I get it. I empathize with all of you and everything you have going on at home. And it's chaos. And now, Maggie, you're putting another thing I have to think about and I have to do on my plate. What the heck? Why am I here? Why am I doing this course? Start small. Don't overwhelm yourself. This is a hard process and it's going to take time to get used to. The device is going to be left in the other room. It's going to be left at school one day. That's okay. Don't be hard on yourself. Try and think about ways that you could incorporate this into daily routines that won't seem so hard for you. Say you like to read stories at night and your child has his couple favorite stories. You could use your device or use the device to program, take pictures, which once again, your SLP can walk you through it because it might be different for different systems. Take pictures of all the different books, put them in a folder, and then right before bed, even though you know probably what book your kid is going to pick, you would say, oh, what book do you want to read? Show them the pictures. And if they can pick Cat in the Hat, awesome. Because now guess what? When they go to school and they really want to read Cat in the Hat, they might remember, hey, if I say Cat in the Hat, and now my teacher's like, oh, great, let's read Cat in the Hat. Now they just realize, hey, this works in different environments. This is great. So food is a great way. Bathroom, toileting, if you're working on that, basic needs are really a good way because kids do them in all environments. So work with your child's SLP, work with an OT, work with a teacher, work with the doctor even. Try to get ways that you can facilitate communication most effectively and then model that. So that was a lot of information to process. You might need to pause me, go back, listen to certain parts. All of you are in very different areas in your journey. So I might have lost you back at gestures. Save this because eventually your child may be using words or a device, and this might be really good information for you to go back to. So digest all that, go back and watch it. You are doing great. Just start small. Don't overwhelm yourself or you will burn out. And then you're going to be like, oh, we tried the device one summer and it didn't work. Well, it didn't work because you weren't consistent. So don't think that you have to have it all day, every day, modeling everything. Great if you can, but don't burn yourself out. Really, this is a long road. We want to be consistent. Nothing is going to change overnight. So you want to start small and then build on there. You're doing great. Stay with me. Bye for now.